Welcome everybody, welcome on into Workout Wednesdays with Dr. Vong and
Miguel Cervantes, the
Cerebral
Cerebral Fitness
Fitness
Trainer.
Trainer.
Those who know me, it's Muscle Migs. That was back in the day. That's the old me.
Yeah, that's it. Now you're all new. So, all right. So what we're going to talk about today, real quick, is what to do about knee pain and exercises. And what I want to say about this, real quick, is remember we're not giving you medical advice. Please follow the directions of your medical provider. But broadly, I want to cover a few things. The first thing I'd like to say about knee pain is if you're overweight, Miguel, what's the best thing to do for knee pain if you're overweight?
Get some pressure off of that knee
Yeah.
while losing some weight.
Yeah, lose the weight. So if you're overweight and you have knee pain, do not force yourself into working out. Most times you will cause more knee damage. Wouldn't you agree with that?
Yes.
Yes, right? So don't try to walk. You're not going to walk it off. You're not going to do squats to get it better. Do not do heavy lifting, all right? So the first thing you need to do is take the pressure off of your knee joint. So what do they say? It's like if you lose 1 pound of weight, it equals what, 8 pounds of pressure on your knee?
You know, I've not heard that. I know postural wise, like leaning forward, what that puts on your spine. But as far as it's got to be,
I think it's 8 or 10 pounds of pressure on your knees per pound you lose. So you're better off losing weight. Okay, so let's assume you've been cleared to work out or do something for your knee pain by your physician. So you're going to go see someone cerebral, someone smart, who's paying attention to your limitations. What's going to happen with, what's the best thing they should do with their knee pain? What's the best way to start? Assuming they've been cleared.
Chronic knee pain,
Yep,
I would support it because 9 times out of 10, your knee pain is coming from your knee's not supposed to be mobile. It's supposed to be stable. It only moves front to back, so it should not be moving side to side. But if you're tight in the hip, if you're tight in the ankle from sitting, from not stretching, just from tightnesses in the tissues around there, then your body's going to take that mobility from your knee. So the first thing I would do is stabilize it, maybe a wrap, some sort of support. It doesn't have to be crazy, even just compression kind of will put a little help alleviate that pressure in the knee. So I would support it first.
So a knee brace of some sort?
A knee brace, not like the NFL line and have the one that has the hinge, like not like that. Just something that's going to smush it a little bit, create a little bit more less discomfort.
If you guys understood what he said, he basically, like, your knee is supposed to flex, you know,
front to back. That's
front to back. It's not supposed to go side to side like that. That's bad. So you want to brace it. All right, so stability is really important.
Stability in the knee, and then you can start obviously want to focus on your diet, you lighten that load overall, but then you got to think, how did that knee become, why is it hurting? Did you just step off a curb and tweak it, and all of a sudden were you doing something dumb in the gym and you hurt it?
Yeah.
Or has this been going on for a long time, in which case you're guarding it with other muscles, right? You favor it, you're limping, and all these muscles are becoming tight and way off balance.
So if it's chronic pain, you could be off balance with your other muscles because you've been trying to guard your knee pain. Is that what you're saying? So maybe instead of working on the knee pain, you should work on some of the flexibility and strength
above and below
of the other muscles. So above and below, like what, your hip?
Like your hip, exactly, and
ankle?
Your ankle. And your foot too, because your foot, you're going to compensate in your actual within the foot. You're going to keep it either more rigid, or you're going to compensate somehow for that knee pain.
Yeah. What about your back? Do you use to compensate?
Absolutely. You're going to throw the pelvis off, and then you're going to throw the alignment of your spine off completely too. So it's not going to happen like immediately. It might not happen in a week or a month or even a year, but 5 years of your not addressing that issue, it's going to affect you one way or the other. Another one is surgeries.
Yeah.
Like people have had a surgery on the knee and they just didn't get back to normal because the rehab was too short and not
Insufficient.
effective.
Insufficient, yeah. So
Insufficient.
so if you're about to have knee surgery or had knee surgery, you really need to take advantage of the physical therapy, right?
Absolutely. First, yeah.
So the physical
Get all
therapists,
your therapy in.
the physical therapists are trained specifically, would you say, to rehab certain surgeries?
And yes,
I mean, they're
and
different
They
than
also have different
trainers.
things, like they have ultrasound. They've got the TENS unit. Like they can use all these different modalities, you know, heat and ice and just whatever else
Yeah.
to stimulate healing.
Yeah.
You can even use like the laser therapy. We used to use it. But when it comes to exercise, you know, that's ultimately up to you. And I think we should just kind of, when we're done talking, it's like, what the hell am I supposed to do? Even if you can't use your knee, tons of things you can do still.
So, two takeaways real quick. If you have knee pain, the first thing to do is to lose the weight, because that will give you more, take the pressure off your knee. That will give you faster results than going to the gym, is to lose weight. And then number two is to work the muscles above and below the knee joint. That's much more important. All right. I hope you enjoyed that broadcast. It was informative. And we're going to take some questions real quick. All right? Cool? Say hi to some people. Larry Thompson has a torn meniscus. Ouch.